When smartphones really first came out, I saw so many parents at the bedside with their phones while their baby was sleeping. And I thought there really is an opportunity here to work with parents to say, you know what, now's a quiet time. And now would be a great time for you to learn a little bit more about your baby and what's happening to your particular baby in your particular situation.
From there, it was just like one scary thing after another. They took a blood test, and once the blood test came back, they were like, you're going to have to deliver in 48 hours. They were like, we have to do this. We don't have a choice. And, you know, it was really risking both of our lives at that point. It just wasn't safe to keep carrying him.
It's a pretty universal feeling for parents that nobody knows what they're doing when they have a baby. And that can be if the baby's full term, 9 months, and it certainly is the case if the baby's come early and is born weeks or months early.
And we know that this can be a very stressful time for families and especially for parents. So this program allows the parents to really work in sync with the healthcare providers, understanding what's happening from hour to hour and day to day with their baby and their progress in the NICU.
So we kind of realized very early on that the phones could be useful, that designing an app to deliver information that was personalized and specific for that particular baby in that particular situation, not only from birth, but 1 week, 2 week, a month into the stay, that we could titrate the exact information we wanted to send to those parents so as not to overwhelm them.
And we think that's a tremendous opportunity to address some of the disparities that impact the lived experience of the parents that are caring for these children.
So NICU to Home is a smartphone app that allows parents to get daily updates of their baby's status in the NICU, connected to the electronic medical record, that also lets parents know who's taking care of their baby at any moment during their NICU stay, and provides personalized education information specific to their baby during their journey in the neonatal intensive care unit, and also allows for parents to connect with their friends and family so everybody's on the same page as they go through their NICU journey.
This is an easy way at their fingertips for them to get some of that really basic information without having to make a phone call. And so that can happen at 2 in the morning, it can happen at noon, and always they're welcome to call, but it's really information at their fingertips. And with our society the way that it is today, it's really a driving force behind, what we've come to expect.
Meg and I had been looking for a way to communicate with family, having to relay information through one, and then that person would relay it to about 4 other people. It became a lot, and there was a lot going on in a very short amount of time. We were looking for a way to communicate with everyone that was secure and also that we could invite people to. So it was like more of a private thing. We talked about doing some sort of social media like Instagram or Facebook messaging in a group or even a group text. But there are some people that we, didn't need to know the entire story. And there were some people that we did want to know the entire story. And the app allowed us to, it really solved all of the answers we were looking for.
I'd like to expand again the outreach of this service. So we try to, make this service available to almost the entire NICU in the US and globally. So that's my hope, because we found a lot of exciting and positive feedback from parents.
And the response we've gotten back from them has really been remarkable, where they really, every parent that has been in the study has started their day and ended their day using the app.